I welcome you all to today's conference entitled Facing the Future Together, Digital Transformation. Now, for the flow presentation, first we will discuss the rationale of the digital transformation, to be followed by the introduction of our guest speakers. Our first guest speaker, who is a representative from the Department of Health, and our second guest speaker, who is a healthcare provider, to be followed by our scientists and commentators. For the rationale of the digital transformation, COVID-19 laid waste to millions of lives worldwide. We can't deny the fact that things the way it used to be is now different from how it used to be without COVID-19. Many sectors have been affected and are finding ways to get back to the new normal to live with COVID-19. According to MJ Johnson, the world shut down and everything was forced to adapt. A sector that has hit most by COVID-19 is education. With schools forced to close due to the threat of COVID-19, a significant challenge has been brought to the two parties of the learning environment, which are the teachers and students, is to migrate from a physical classroom to online learning with the use of different platforms, namely Google Classroom, Microsoft Teams, and Zoom. Teachers and students were not prepared to transition to online learning due to the lack of gadgets and expensive yet poor internet connection in the country. The government also switched to online platforms to meet the demands of the public for their needs. Different sectors of the government initiated their own desktop class architecture and mobile-based applications. With a forced change of this magnitude, we witnessed the impossible become possible. The pandemic pushed us to the extremes by using technology in ways we have not done before. In the previous years, it questioned us out the way we work, and we are being forced to do this and that to comply with the said standards and requirements. And now, this year, we have our answers. The implications of COVID-19 have been catastrophic, but one silver lining is the opportunity to maximize the benefits of digitization for improved livelihoods. That's all for the rationale of the digital transformation.
Thank you for delivering that amazing rationale, Mr. Peliño. And once again, good morning, everyone. I hope all of you are having a wonderful day today. So before we start to discuss the main topic of our conference today, which is digital transformation, I would like to introduce to you our guest speakers for today's conference. Please welcome our first guest, Dr. SHAMIAH Porcelin, our DOH representative for today, who graduated at San Pedro College with Latin honors and took her master's degree at Cebu Doctors University, and is also a Red Cross Youth Volunteer and is currently working at the Department of Health at Central Office, Santa Cruz, Manila, Philippines. Thank you for coming in this conference today, Dr. Porcelin. We are very glad to have you here, and without further delaying this introduction, you may now begin your discussion.
All right, hello everyone. Allow me to greet you a wonderful morning. I hope all of you are doing fine and that the internet connection is well enough for the whole duration of our conference. So I'm sorry for the unnecessary background noises. So let us start. Next slide, please. The Philippines Department of Health envisions Filipinos to be among the healthiest people in Asia by 2040. Excuse me. The DOH began its digital transformation journey in 2016 with the goal of creating a strong, fair health system powered by technology. As we all know, the global pandemic has caused drastic changes to populations. And to control the transmission of this lethal disease, societies have halted and suspended the majority of economic activities, permitting only the most essential ones, such as those related to food and health. The crisis has vividly demonstrated the potential of digital transformation, and some changes may now be too profound to reverse. Frankly speaking, we are faced with a future where jobs, education, health, government services, and even our social interactions may be more dependent on digital technologies than ever before, right? So to support this claim, we shall proceed to the next slide. And let us all read, widespread connectivity has allowed individuals to adapt to the crisis. Next slide. Now, we have two main topics to cover. First is the Microsoft Power BI dashboard, and second is the future of telemedicine and universal healthcare. Let us first discuss the Microsoft Power BI dashboard. As I have mentioned, the Department of Health started the digital transformation journey in 2016 to, to keep pace with the pandemic. The DOH needed a platform that was capable of managing the data from all the vaccination sites across the country in real time. So that is how the Microsoft Power BI started. Moreover, the dashboard also serves up national, regional, and granular insights to local governments, enabling them to, of course, make evidence-based decisions in dealing with COVID-19. Next slide. Next slide, please. The following are the various usage of Microsoft Power BI dashboard. First off, the DOH needed to establish an effective COVID-19 vaccination strategy. Primarily, it is designed as a vaccine monitoring. Vaccination sites submit daily reports, and what's really helpful too is that the consolidated data influences decision-making with respect to controlling the pandemic during lockdown. Also, Microsoft Power BI was deployed in COVID-19 Bakuna Center Registry, or our CBCR, which is close to 10,000 users. The dashboard is designed to present visual data, and it has become much easier to see if there are issues that needed to be addressed, which again helps the government focus its response. Third, enabling access, ease, and insight. The national government, our LGUs, and the 6,350 vaccination centers can access all of our DOH published dashboards, which provide insights on how our country and its specific regions are performing. At present, more than 1,800 LGUs are actively using our dashboards, and feedback from them has been quite positive. So to recap, first, Microsoft Power BI dashboard works as a vaccine data monitoring, since here in the Philippines, we have massive number of population, which again correlates to massive number of data. So truly, our Power BI is really a great vaccine strategy. Second, for our CBCR, our COVID-19 Bakuna Center Registry, our Power BI is the one that summarizes the reports received from specific regions, and it also notes the issues that needed further attention. Overall, feedbacks from users are positive. Now, let us simply shift focus to the future of telemedicine and universal healthcare. Next slide po. Since there is an increased demand for health-related technologies to manage the pandemic, the DOH launched a COVID-19 hotline, which soon morphed into providing telemedicine consultations. To further discuss how this works, unconventional and innovative procedures have been implemented, such as first, allowing remote patient consultations. Mobile applications are used by establishments for contact tracing, and sensors are used for checking temperature before entering a building. Next slide. Next slide, please. So for our conclusion, as our country, the Philippines, works to respond to and recover from COVID-19 crisis, now is the moment to ensure an inclusive digital transformation with coordinated and comprehensive strategies that build resilience and bridge digital divides for a post-COVID era. Thus, with technology, it moves the Department of Health closer to realizing its vision of making sure that Filipinos are among the healthiest in Southeast Asia. And that is the end of my presentation. Again, I am Dr. SHAMIAH Porcelin, your Department of Health representative. Thank you so much for listening and have a good day.
Thank you for enlightening us with the facts you shared, Dr. Porcelin. And now let's welcome our second guest for today, our outstanding healthcare provider, Dr. ELIEL Marie PALCO, who graduated at the University of the Philippines with Latin honors and is now currently working at Chonghua Hospital. Pleasure to have you in our conference today, Dr. PALCO. And with that, you may now begin with discussing your topic.
Thank you so much. All right, so pardon me in advance if my connection will be lost now, pero God forbid. Okay, digital transformation is no longer just a part of future direction or a nice to have. It has now become an imperative. The COVID-19 global crisis has undoubtedly brought about huge changes in healthcare systems all over the world, not just in our country. One of the major impacts which it had would be its role in serving as an impetus to accelerate the digital transformation of healthcare globally. The Philippine government has been proactively using technology to keep citizens informed, educated, and updated. A huge amount of emphasis was placed on corporate health. Primary care clinics were built within large corporations themselves, greatly facilitating employees' visits to the clinics. With the onset of COVID-19, doctors were open-minded and fast-thinking, which allowed for the smooth and swift transition to telehealth. For those who don't know, or for those who weren't aware what telehealth is, it is the distribution of health-related services and information via electronic information and telecommunication technologies. It allows long-distance patient and clinician contact, care, advice, education, intervention, monitoring, and remote admissions. With this continued provision of medical services to employees, they could continue working from the safety of their homes whilst receiving the appropriate medical assistance. Next slide, please. In connection to this, the Department of Health has a website that not only lists the number of patients under investigation or the PUIs, but also shows a map of their general location. Mainstream media coupled with social media were the key online platforms which were utilized to provide constant updates about new cases or any cluster outbreaks within the country. Contact tracing applications such as MyTrace were set up using a QR code digital log system. Each store or restaurant would have a unique QR code which stores the phone number of each individual entering when the user scans the code. In the event that someone who enters the store gets positively diagnosed with the virus, this information can then be promptly disseminated to other visitors of the store and appropriate quarantine actions meted out if necessary. All right, so we can also observe this kind of QR code digital log system, no, when we enter, of course, in malls, in churches, some of the churches, and of course, in hospitals. Virtual clinics and electronic appointments were also made readily available to the public so they can continue to receive the required healthcare services even from their homes. However, we cannot deny the fact that the use of digital technologies in the Philippines is still below its potential, with the country's digital adoption generally trailing behind many regional neighbors. The digital divide between those with and without the internet leads to unequal access of social services and life-changing economic opportunities. That is why the government is making a fast move in order to heighten the country's internet connectivity. On the other hand, while this public health crisis has tragically cost us lives, livelihoods, and our sense of normalcy, we still have the power to shape what comes next. COVID-19 has forced healthcare leaders and clinicians to move faster, work smarter, and take a more focused approach to decision-making than ever before. Overall, digital health solution and technology will play a crucial role in the difficult work of optimizing processes and systems for greater efficiency, financial viability, and enhanced outcomes. Through this unexpected disruption of the status quo, there is a tremendous opportunity to create a new normal that is significant improvement over the old normal. That would be all. I hope you were able to grasp the information. Once again, I am Dr. ELIEL PALCO, your healthcare provider representative. Thank you and God bless.
Thank you for informing us and sharing some of the facts you knew this particular topic, Dr. Palco. And thank you for both of our guests on participating in this conference. And now let's move on and have our supervisor, Ms. NAURINE PALOMAR, take the virtual stage.
Thank you, Mr. J. Mark. So please forgive me because I think my internet connection is unstable right now, but Amidst that, I would like to share to you what I have gathered from the outputs of our guest speakers. So they have shared their knowledge regarding the technological situation of our country amidst this pandemic. Next slide, please. It has brought drastic changes to the lives and livelihoods of Filipinos, especially in their health. However, the Department of Health was able to adapt to and cope with the situation with the help of technology. So by this, Filipinos were able to adapt to the current crisis and become more dependent on using technology as an aid for jobs, as well as education in order to minimize and reduce the number of cases and transmissions. Next slide, please. The DOH started digital transformation way back in 2016, and in order to keep track of the pandemic, a Microsoft Power BI dashboard and a COVID-19 Vacuna Center registry were created, enabling access, ease, and insight into future telemedicine and universal healthcare. So the aforementioned are used for monitoring vaccinations, daily reports, and to heighten the focus of the response against the virus. Additionally, the app called MyTrace was created to easily track people using the QR code digital log system. There were also virtual clinics created and made available so that Filipinos could receive mandatory healthcare services from the comfort of their own homes. Next slide, please. So, in line with this, the fast-changing digital transformation needs a stable connection, and the government has taken action to improve the internet connectivity in our country. Indeed, we can say that technology plays a vital role in optimizing solutions for better efficiency, executability, and its effects. Thus, this new normal necessitates a significant shift in coordinating strategies for improved Filipino resilience. That is all. Thank you.
Thank you, Ms. Naurine. And lastly, we have our Chief Executive Officer, Mr. Francis Petros, to give us his thoughts in this conference that is held today.
Wow. I, for a while now, have never been enthralled by the blazing knowledge and expertise a person can proffer to a crowd. Kudos and our gargantuan thank you to our brilliant and clever frontliners who in full willingness agreed to be guest speakers in today's conference event. Ms. Shamaya, you embody such eloquence I rarely encounter in people. I, representing all of us, express our utmost and genuine gratitude to you for raising awareness on how the Department of Health, through their hard work and efforts during this crisis, has continuously adopted and responded to the overwhelming demands and alterations to still deliver and cater people with outstanding healthcare service, especially now that it is the utmost and primary need of the Filipino people. To Ma'am ELIEL, please remember this phrase from me. You are such a woman of intelligence and altruism. In behalf of all the people that benefited from what you have relevantly imparted, I thank you for your effort and dedication to make everyone fully and in all arm grasp, comprehend, and appreciate our medical frontliners for their invention and sacrifices of trying to bring our country the supposed to be normal we are to have and we really deserve, a reality without this global health crisis. You two strong and independent women represent the true heroes of our country. Of course, not the politicians themselves, but instead the entirety of the medical frontliners of our nation. You guys are a beacon of hope in this cruelest of times. We are immeasurably grateful for the blood and sweat you have shed in your duties. Our love for you is unbounded. However, before formally and officially closing this course of action, I have one essential thing to further stress out and put into spotlight. It would be this: digital transformation as a pandemic demand to be fulfilled with and a coping response to be taken into account is sadly not for everyone. I am aware of its gravity and significance, which is for us to cope up with their seemingly fast evolving technological world. But access to what makes this thing work is a big burden and struggle to not just some, but many, especially the poor and the underprivileged. One impeccable example would be the avenue and modality of how education is prompted in today's time. Schools have resorted to either modular and online classes to still pursue education in the middle of a pandemic. This resulted in a wide array of demands from both teachers and students to comply with the necessities imposed by the sudden transition. This taught in return staples a vital message that people, in some aspects, cannot digitally transform if they lack the requisites to be able to embody, perform, and catalyze such actions. As a vital option alternative to be able to at least make things running amid a global dilemma, the need for normal people to channel this digital transformation, specifically making ends with its accompanying demands, hinder them from progressing and moving forward, or worse, complying or surviving, just because they are not served with the same resources and opportunities as much as the people who have been triumphant in digitally and technologically transforming even in the squarest of times. To compellingly reiterate, in this pandemic, digital transformation is a must, but it can't be for everyone. I believe we have come to an end to this wonderful activity. I thank you all 100-fold for spending time with us. I hope we can apply and put our takeaways from this event into reality. Stay safe always, and Caritas Christi Origit Nos.
Thank you, Mr. Francis. And that being done, let us now present a certificate of appreciation to both our guest speakers, to Dr. SHAMIAH Porcelain. Let me read the citation: for imparting your invaluable time, insights, and expertise during the conference entitled Digital Transformation, given this December 8, 2021 via Google Meet, signed by our supervisor, NAURINE Palomar, and signed by our CEO, Francis Miguel Petros, and the same certificate is presented to Dr. ELIEL Marie PALCO. And that concludes this conference today. Thank you for listening. This is your host, J. PACRES, now signing off.